Public health officials investigating a suspected case of monkeypox right here in L.A.
That's right. There have been 4 cases already reported in the state, all up north in the Sacramento area. KCAL9's Rachel Kim is live in North Hollywood with details on the first reported case here in Southern California. Rachel?
Yeah, Juan and Susie, LA County Department of Public Health Director Dr. Barbara Ferrer says that patient traveled domestically and that the health department is now working with the state and the CDC to conduct contact tracing. Now, Dr. Ferrer says she's not worried about a massive outbreak of monkeypox at this point. She said their goal right now is to make sure medical providers and the general public are well prepared with good information.
We've known about monkeypox for decades. We know it is much less easily spread than COVID.
Health officials are spreading the word about monkeypox to help educate people and to avoid any misconceptions. The LA County Department of Public Health just confirmed their first presumptive case. They say the adult patient recently traveled and had a known close contact to a case. Although the patient is symptomatic, they're isolated and doing well.
Is this something to be alarmed about? The answer is no.
Infectious disease doctors say there's no need to be overly concerned about monkeypox, but they say it's contagious and believe it's important to take measures to prevent transmission. Monkeypox is a flu-like illness that begins with fever, headache, muscle ache, backache, swollen lymph nodes, chills, and exhaustion. Advanced symptoms include rash, blisters, and scabs.
The rash can vary from just, red skin to small boils and pimples that have fluid in them, and these can burst open, and that's how it is transmitted to another person.
Monkeypox spreads between people primarily through direct contact with infectious sores, scabs, or bodily fluids. It also can be spread by respiratory secretions during prolonged face-to-face contact and during intimate contact.
The incubation period can be up to 2 weeks and as long as 3 weeks. So if you've been exposed to monkeypox, you need to wait for 3 weeks before you say, I don't have it.
Doctors we spoke with say most people who have monkeypox will have mild symptoms and recover on their own after a few weeks. There are no proven established treatments or therapies for it.
This is a disease for which contact tracing can be very effective because it requires the close contact. The work that the Public Health Department is doing right now in identifying the close contacts of cases, reaching out to them, asking them to isolate in some instances, that can be very effective for this type of disease.
Local health officials add that it is very important to stay vigilant and to remember that the same precautions recommended for COVID-19 will also be very effective at preventing monkeypox. That includes washing your hands often, wearing masks in public settings, and avoiding close contact with people feeling ill. Reporting live in North Hollywood, Rachel Kim, KCAL9 News.
Scary, no doubt. All right, Rachel, thanks.